Hi students, and welcome to part 2 of this week's lecture series on music neuroscience and neurologic music therapy. So hopefully you've already watched the lecture on music neuroscience. You should do that first. This will make more sense when you watch this. Okay, so neurologic music therapy techniques, a lot of times these are thought of as only being used with, say, somebody who's had a stroke or has Parkinson's, so mature adults. However, these techniques are also used with children, so children with special needs, with developmental disabilities, things like autism or Down syndrome, and also children that have had brain injury, who have lost skills that they already had, but who also had not yet attained some other skills. So when you're thinking of these techniques, I'll try to give examples of different populations, different age groups, but just keep in mind that really all of these can be used with any age group. They're not specific to adults. They're not specific to kids. That being said, most of the research that has been done which looks at any of these specific techniques, most of that has been done on adults. But for the most part, we can still generalize it to being effective for kids as well. In this lecture, I provide information on the research as well as the specific techniques, and then there are also video examples. I'm not going to show you the video examples in this lecture summary that I'm doing right now. Those you need to watch on your own. I'm also not going to read through all the slides, just like on the first part of this lecture series. It's your job to read through them. I'm just going to try to highlight key points. So there is always this question, well, if music neuroscience is so new and neurologic music therapy is so new, is there research? And as I mentioned in the part 1, yes, there is research, and I think this is just going to explode as there's more and more interest and, of course, funding for research in music neuroscience, and also as we get more neurologic music therapists who specialize in this and get more of them to do research, then that's also going to build the body of literature. The techniques are divided into 3 domains: sensory motor, for example, that would be things like walking, and large motor and fine motor. So things that have to do with the physical, with the body. Speech and language, that's pretty obvious, so both the sounds of speech and also language vocabulary. And then cognition. These techniques are not used quite as much, but they're still very beneficial. But those are the 3 domains. These are the techniques for sensory motor, and in the lecture I've got more details about each of these, so make sure that you read through them. What I'll highlight is rhythmic auditory stimulation. This is basically almost exclusively for walking, for someone who has had an injury or has a debilitating condition such as Parkinson's, where it's causing them to decline over time. It's progressive. This is for gait training. It's for walking. It's for improving aspects of their gait or walking. Gait and walking are the same thing. Pattern sensory enhancement. This is to help with a lot of the same goals that an occupational therapist would have. So upper body and lower body strength and range of motion, things like that. And this is fine motor and gross motor. This technique, TEMP uses instruments to help with functional movement. So we're not always playing an instrument traditionally. When we use a drum, typically when you would play a drum, you would use your hands. However, when we're using this technique, somebody might be actually trying to play the drum with their foot. They're trying to kick and hit the drum. It's a functional movement, and we're using the instruments in a non-traditional way. So these are the slides that show or talk about these techniques in depth, and I've also listed specific populations that typically receive this. Here's a video, you'll want to watch that. It shows what this technique looks like. And I've also included some research just so that you can kind of see what's been studied so far. So you'll want to go through each of these techniques. I'm not expecting you to memorize them. You need to watch the video so that you can recognize the techniques that I've shared with you in video, so that if you were to see the video, you could say, oh yeah, that's RAS versus a speech technique. So you'll want to go through all of these. Here's another video. And this one actually shows this technique with a pediatric patient, so that'll be good to see. But know that it can also be used with adults. These are all the speech and language techniques. You might have to read through them a few times. Sometimes they can be confusing. Melodic intonation therapy is probably familiar to you. It's also used in speech therapy a lot by speech therapists. Musical speech stimulation would be, for example, "You are my," and then the patient would fill in "sunshine." Rhythmic speech cueing is the speech version of rhythmic auditory stimulation, that technique where we're using a metronome beat, we're using a steady beat for walking. Well, this is the speech version of that, and so I've got an example of this, but it's just basically they're going to be singing a functional phrase. So we're not taking familiar music, we're taking a functional phrase. In the example, I think it's something like, "I want cornflakes." And they put it to a really simple melody, and there's a metronome where they're tapping a steady beat along with that. So it's very similar to RAS, it's just with speech instead of walking. Vocal intonation therapy, therapeutic singing. Now therapeutic singing, vocal intonation therapy is very similar to vocal exercises. So if you've ever taken voice lessons, those exercises would be what you would use in this technique. With therapeutic singing, this is kind of the global technique where we're going to be singing familiar music and practicing all the things we've been working on in the other techniques. So it's reinforcing the other speech and language techniques. OMREX, an example of this would be using an instrument such as a harmonica, and that's the example that you'll see, and using that to increase breath support and taking big breaths and getting a lot of sound out. So it's focused on the apparatus, the physical apparatus of making sound. DSLM, this is not a technique itself, but whenever we use one of these speech and language techniques with a pediatric patient, this is what we call it. So it's just a global term, so whenever a music therapist would be using this, they'd also specify which of the techniques it would be. But anyway, it's not a technique itself, it's just a global term for when we're using these techniques with a child instead of an adult. PsyCom is a technique for anyone who is not going to ever be able to talk. They're not going to be verbal. It's teaching a different way to communicate instead. So again, I've got more specific information about each of these. I've got some videos so you can see what they look like. A lot of these are with pediatric patients, but you'll see some of them with adults too. So make sure you read through those and can recognize any of the ones I've shown in video. The cognitive techniques, as I said, these are not used quite as much. Now, I use the first one a lot with end-stage dementia patients that don't really respond to much anymore because of their disease has progressed so much. But that's all, and this is also used with coma patients. This is going to be getting them to say open their eyes or to look over at the guitar. We're not expecting them to like suddenly sing along. It's going to be really simple. It might be just increasing their heart rate. So that technique is used with really low response patients. Let's see. There are some video examples of these other ones. Like I said, a lot of these are not used a lot, and I definitely don't use them a lot just because of the populations I work with. So read through these as well. This last technique, it's a newer one, and it's not really a specific technique. It's kind of, it includes a lot of different interventions, and the interventions are all used for psychological goals. So they're much different than, say, music therapy for speech or for physical rehab. These are the techniques that would be used with mental health patients. And there are lots of different things. I've included an example like the ISO principle, things like mood control, so improving someone's mood would be an example of MPC. So it's kind of another global technique like the DSLM I was mentioning with children. So those are all of the techniques. Make sure that you read through them. Make sure that you watch the video and can recognize any of the techniques I've shown in video. Again, make sure that you've watched that music neuroscience lecture too. And then I've created a discussion board thread, and what I want you to be thinking about before you go on there is how music neuroscience and music therapy, neurologic music therapy, how they're different, how they're the same, how they can work together, how they influence each other. I want you to be thinking about those things, and then you can post your answers to those questions on the discussion board. Please post by Thursday night, and then check again on Sunday and comment on at least 3 other posts. So I expect we'll have some good conversation on this one, and I'll probably post one more, end of the semester lecture just to talk about class business and make sure everybody's on the same page. So also make sure that you're working on your research papers. Post them so that others can read them and give you good feedback. Make sure you read the grading rubric for yourselves as you're writing your papers, and also as you're giving feedback, so you can be specific on what your peers need to work on. For example, maybe you notice a lot of APA mistakes. Maybe they're not citing anything within their paper, they just have a bibliography. That would be a major thing that they would need to work on. They'd miss a lot of points based on the rubric. So I will talk to you soon. Have a good week.
Mommy.